This medication is like the natural glucagon in your body, which helps raise blood sugar by releasing stored sugar in the liver. It is used to treat very low blood sugar, hypoglycemia, that may require assistance from others. It's important to make sure that a family member or caregiver knows where you keep this medication and how to use it. Glucagon may also be used before certain X-ray procedures of the gut to slow down movement of the stomach, intestines, and colon, which can help make the X-ray clearer. The recommended dosage and timing for this medication will vary based on individual needs, so it's best to consult with a healthcare professional for personalized guidance. When you receive your Glucagon 1 mg solution for injection, make sure to read the patient information leaflet and instructions for use provided by your pharmacist. Keep this medication handy in case it is needed. If you have any questions, ask your doctor or pharmacist. Caregivers should be aware of the symptoms of low blood sugar and be instructed on how to give glucagon if needed. It's important to treat very low blood sugar right away to prevent serious effects, such as brain damage. Before using, check the medication visually for particles or discoloration. If either is present, do not use the liquid. Make sure to learn how to store and discard medical supplies safely. Inject this medication into a muscle or under the skin as directed by the doctor. The dosage is based on your age, and for children, it is also based on their weight. After giving this medication, seek medical help right away. If the person is unconscious, turn them on their side to prevent choking in case they vomit. If the person does not wake up after 15 minutes, another dose may be given, if available. When the person wakes up and is able to swallow, give them a quick sugar source such as glucose tablets or juice. Keep their blood sugar level up by having them eat snacks like crackers, cheese, a meat sandwich, or milk. Always call your doctor right away when an episode of very low blood sugar has occurred. You may need more medical treatment, or your insulin dose and diet may need to be adjusted. If you experience nausea, vomiting, or headache after taking Glucagon 1 mg solution for injection, or if you notice irritation, redness, or swelling at the injection site, tell your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. However, if you experience any serious side effects such as a fast or pounding heartbeat, seek medical attention right away. While it is rare, a serious allergic reaction to this drug can occur, so be sure to get medical help if you notice symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. If you notice any other effects not listed here, be sure to contact your doctor or pharmacist. Before using Glucagon, it's important to talk to your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions, so make sure to discuss this with your healthcare provider. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have a tumor of the pancreas, adrenal gland problems, or if you have poor eating habits. Low blood sugar is more likely if you don't consume enough calories from food or if you do unusually heavy exercise. Symptoms of low blood sugar include sweating, shaking, fast heartbeat, hunger, blurred vision, dizziness, or tingling hands/feet. It's a good idea to carry glucose tablets or gel with you to treat low blood sugar. If you experience any of these symptoms, it's important to raise your blood sugar by eating a quick source of sugar or drinking fruit juice or non-diet soda. Make sure to speak to your doctor right away about your reaction and the use of this product. To help prevent low blood sugar, make sure to eat meals on a regular schedule and do not skip meals. If you miss a meal, check with your doctor or pharmacist to find out what you should do. If you are pregnant, be sure to tell your doctor before using this medication. It is unknown if this drug passes into breast milk, but it is unlikely to harm a nursing infant. Make sure to consult your doctor before breastfeeding. It's important to be aware that Glucagon 1 mg solution for injection may interact with other medications, which could affect how well your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication routine. If someone has overdosed and has serious symptoms such as passing out or trouble breathing, it is important to seek medical help immediately. This can be done by calling 911 or a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It is important not to share this medication with others. It is recommended to attend a diabetes education program to gain a better understanding of how to manage diabetes with medications, diet, exercise, and regular medical exams. It's also important to learn the symptoms of high and low blood sugar and how to treat low blood sugar. It is essential to regularly check your blood sugar levels as directed by your healthcare provider. The benefits of using Glucagon 1 mg solution for injection include its ability to raise blood sugar levels in cases of severe hypoglycemia, or low blood sugar. The daily dosage and optimal timing for taking this medication should be determined by a healthcare professional based on your individual needs and medical history. Glucagon 1 mg solution for injection is used to treat severe hypoglycemia, which is a dangerously low level of blood sugar. It is also used as a diagnostic aid for certain types of stomach and intestinal problems. This medication is given by injection into a muscle or under the skin by a healthcare professional. If you are using this medication at home, learn all preparation and usage instructions from your healthcare professional. The dosage is based on your medical condition and response to treatment. In the case of severe hypoglycemia, this medication is usually given as a single dose followed by a meal or snack containing carbohydrates. It is important to always have a source of sugar such as orange juice, honey, candy, or non-diet soda available in case you experience symptoms of low blood sugar. It is best to take this medication when you are experiencing symptoms of severe hypoglycemia, as directed by your healthcare professional. When it comes to storing Glucagon 1 mg solution for injection, it's important to follow the specific instructions provided by the brand you have. Be sure to keep all medications out of the reach of children and pets. When it comes to disposing of this medication, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard any expired or unneeded product, and consult with your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.